As more states start to legalize the use of marijuana across America, there has been a significant increase in use by pregnant women. In a recent study published by Kelly Swenson, it was found that in the state of Colorado, 69% of bartenders advise the use of cannabis products during pregnancy for nausea and for increased appetite. This, despite having no training, education, or medical licensing to do so. In fact, most bartenders in Colorado discourage pregnant people from contacting their medical provider, claiming they are all pill pushers and just spreading propaganda. Where marijuana is legal, women are more likely to use preconception, prenatally, and postnatally than in states where it is not legal for recreational use. Since the patient in our video is already pregnant, here's a quick note on how cannabis affects fertility. In males, it can cause erectile dysfunction, abnormal sperm production, and testicular atrophy. In females, it can lead to infertility, irregular menstrual cycle, and issues with embryo implantation and development. We are highlighting this population today because there is a growing need within the medical community to educate their patients.
Hi, Brittany. Congratulations on having twins. That's very exciting. Thank you so much for making time to go over your lab results with me.
Hi, Nurse Jenna. Thank you so much. This is my friend Vivi. She is my buddy. Yes, Vivi is my support person. I've been super sick. My husband is away working as usual, so she's been a godsend. I've been really sick and just kind of emotional, and it all started the second I got pregnant.
Okay. Yeah, as long as it's
Yep.
okay with you, it's okay with me. Hi, Vivi. It's nice to meet you. Everything looks just fine so far, but I did want to go over your urine tox screen with you. So you tested positive for marijuana, and I was wondering if you felt comfortable talking about that with me and your usage history. I just want to let you know you aren't in any trouble, and any information you share is confidential.
Okay. Yeah, I know I need to cut back. Let's see. Marijuana has just kind of been a part of my life. I used to hate it, but I had a boyfriend that grew it, and once it got legal, everybody kind of just started doing it. So a lot of people just kind of like everybody does it. So from there we broke up and I started using a lot. And since I was depressed, I kind of just decided to turn it into a business. We're in over 100 dispensaries. We're doing really well. And, shortly after that, I met the twins' father. And then we broke up, and then I started smoking even more. So we reconciled about 6 months ago, got married about a month ago, and then we got pregnant over our honeymoon. So things have just happened super fast. Now I'm going to be a mom, and I have some habits and some nausea. And I don't know what to do.
Anxiety.
Blah.
Are you okay?
No.
Sorry.
I really want sushi and I can't have that either.
It's okay. Don't be sad. I'll be here, okay? So, Nurse Jenna, I would like to add that my friend has been very tired too, and she's had a demanding job, and she has been very sad and missing her husband. Anything she eat make her feel very sick, and I'm just worried about her health, and I'm especially worried about the twins' health.
Okay. Well, it sounds like there is a lot going on and a lot of changes happening. Do you mind if I ask you a few questions? It might be a little personal.
That's okay.
Okay.
I got this.
All right.
Some water.
Yeah.
So have you been taking the medication to help with the nauseousness and or not medication, the marijuana Have you been taking it to help your nauseousness and your feelings?
Yeah, actually, the name of my company is called Plant Medicine. It's organic. Um, we know exactly where it comes from, and it just seems to be one of the things that seems to help.
Okay. So how much do you use in a day?
Um, well, I can tell you, I take one in the morning, I take one in the afternoon, and I try to take one at night, just to kind of give me like a steady dose throughout the day. So maybe 10 milligrams a day.
Okay. So like microdosing type of stuff going on. Awesome.
Very low dose. So I don't think it's gonna really do anything to those guys, but they're sure kicking my butt.
I can totally understand that. And then, so you just do edibles now, or do you smoke too?
No, it's just edibles now.
Okay. All right. Well, thank you for discussing this with me. I would like to go over some medical risks involved with marijuana use during pregnancy. It's not very common knowledge as of yet, but it is very important for us to know so we know how to help you and advocate for you during labor. Research is finding that marijuana use during pregnancy mirrors the effect of tobacco during pregnancy. Prenatal exposure has been found to cause infants to be born small for gestational age in size and weight. So they're like smaller when they come out than they need to be. They have a higher risk of being born prematurely and spending more time in the NICU. Um, Especially with twins, twins can be born earlier anyways, and to add marijuana use or tobacco use, that can increase the amount of risk for them to be born even sooner, which would not be a great thing. There is an increase of a stillbirth or sudden death infant syndrome within the first year, and they could have impaired cardiac development, disruption of brain development, and many neurocognitive development problems that aren't seen until later in childhood. You should also avoid being around people that smoke marijuana, especially after the twins are born, because they can still get those effects from someone in the home still smoking marijuana. We should discuss your plans for feeding your babies. While we encourage breastfeeding, we may need to consider formula feeding depending on your future marijuana use. Research shows that marijuana can cross the placenta and enter breast milk, remaining in the milk ducts from anywhere between 1 to 6 hours after use. If you'd like to explore this further, I can arrange for a lactation specialist to contact you.
Well, I didn't know about that, so it couldn't hurt, could it?
No. So are you planning on breastfeeding?
I was until you said that.
Okay. All right. Well, we can definitely discuss that a little further down the road as well. Now, while Dr. Smith and I can help guide you through your pregnancy and delivery, I've invited Mindy here, our clinical nurse social worker, to discuss ways that she can help you postnatally and give you advice about postnatal marijuana use.
Okay, I think that'd be great.
Yeah.
Hi, Brittany and Vivi. My name is Mindy. I'm the social worker here at DCNOB Services, and I just wanted to thank you for honesty and openness about your drug use and history. And congratulations, I hear you're having twins.
It's making me pretty sick. But
Yeah, that's the hard part about pregnancy is it definitely messes with your body. So here at DCNOB, we're starting a new initiative to inform our patients about how the use of marijuana before, during, and after pregnancy can affect your child as it develops from conception through adolescence. And like Nurse Jenna said, it's definitely not like common knowledge yet. It's definitely things that are developing as more and more states legalize it. So as the social worker, my job is to help guide you through your postnatal life and help you get aligned with services, support groups, or organizations that can help you with anything that you would need while you're transitioning into your role as a mother and even beyond. So first, I usually like to inform all of our clients on Colorado's substance law use during pregnancy. And this isn't meant to scare you in any way, but just to help you make informed decisions. So Colorado's law states that marijuana use during pregnancy is unsafe and can have legal consequences. Even though it is legal at the state level, it's still not legal federally. So some hospitals routinely test all of their babies that are born the cord blood for marijuana, and if it's tested positive, then they can choose to notify CPS, but that's based on like their organization or their hospital's policy. Not every hospital does this. So it's definitely something that, depending on usage and how you want to move forward, just keep talking with your doctor, and these things you can find out. Like the hospitals can let you know if they routinely do it or if it's only done upon like they suspect something's wrong. But they can also just keep helping you explore safer options for managing the pregnancy symptoms that you're having. And just know that we're not asking for any decisions today. We're just giving you information. So as Nurse Jenna mentioned before, exposure to marijuana impacts many parts of the developing brain and neural functions. So this exposure, not only in utero, but after the babies are born, from like secondhand marijuana smoke, can potentially lead to issues such as like reduced gray matter in the brain, increased risk in developing autism spectrum disorder, ADHD, early onset schizophrenia, and several other mental health disorders like depression and anxiety. So as the babies grow, the risks increase, and then they also start to affect the baby physiologically. So it's definitely best to avoid marijuana smoke secondhand, just like it is tobacco smoke. And I know all this is very overwhelming. So if you'd like, we can always schedule another time to discuss any concerns that you have developmentally for the babies. And there's obviously no guarantee that your child will develop any of these issues. But research is revealing more and more as there's more studies made available. If you're interested at all in quitting or even just reducing the amount of marijuana use, I can provide you with a packet of resources of information. And if you would like to look into it, just like right now, there's an organization called Tough as a Mother. And so if you go to their website, toughasamother.org, they've got tons of resources, and they can connect you with places in your city where you live or in your area, and they can help you. So if you don't have any other questions, I just want to thank you for agreeing to meet with me, and it was lovely meeting both of you, and I hope to be hearing from you once those little babies are born.
Thank you.
Thank you. It's very helpful.
Do you have any other questions for me?
What about the nausea?
So the Dr. Smith, your doctor, we can discuss what is safe for you to take for the nausea. There's definitely some medications out there for you to take as an alternative to your marijuana, and it's probably safer for you and your baby. But we can definitely get the whole team involved, and we'll discuss things for not only your nausea, but also your feelings, talk about like therapies that could probably help as well. But we'll definitely keep in touch and collaborate with you and our whole team for any issues you have.
Okay.
Yeah, I'll be there for you anyway. I can. Okay.
Thanks.
Really.
Yeah. All right. Well, I would like to follow up with you over telehealth in 4 weeks to see how you're doing, if that's all right.
That'd be great.
Yeah.
I can use as much help as I can get.
Perfect.
And then I gotta add a black box label to my products. So I don't get sued.
Yeah.
Okay. All right, we